Hello, everyone. My name is Naaman, and today I'll be discussing the Rondon Devant case. This case involves the tragic medication error at Vanderbilt University Medical Center and raises serious questions about professional responsibility in healthcare. Some relevant facts about this case. Charlene Murphy was a 75-year-old patient who was given the wrong medication during preparation for an MRI scan. The drug Versed was prescribed, but instead Vecuronium, a very powerful paralytic drug, was administered after a nurse used an override in the medication system. As a result, the patient became paralyzed and passed away due to respiratory failure. The stakeholders in this case include Charlene Murphy and her family, who suffered the greatest loss, Nurse Radon Devant, because her career and future were directly affected, Vanderbilt Medical University or Medical Center, other nurses who were impacted by the legal precedents this case sets, and lastly, we have future patients who have been impacted by how the safety standards are now going to be enforced in the medical industry. Major ethical issues and questions include would be the failure to uphold professional duty. This case brings up negligence, patient safety, and accountability in healthcare. It also raises concerns about whether the hospital leadership met its responsibility for honesty and transparency after the incident occurred. My position on this case is that ignorance is not an excuse in healthcare. Accidents happen. We're all human. We make mistakes. And often they're unfortunate and unpredictable. But complacency and lackadaisicalness cannot justify a fatal mistake. Nurses are trusted with human lives, and that requires constant attention and responsibility. And due to the mistakes of Rodin Devant, a life was lost due to carelessness, and that loss must be taken very seriously. Um, Otherwise, I would say most hospitals need to avoid people who would be so careless in their actions. Um, Evidence that supports my case: the nurse used the override system when the situation was not in an emergency. The medication label was not properly checked before administered. The paralytic drug was given without sedation, which directly caused the patient to stop breathing. Um, and I think all of these actions show are enough to show that safety steps were not taken. They were completely ignored, and on multiple accounts. So overall, a case is a bad situation. The framework I'll be using is deontology. In healthcare, that means providers have a duty to do no harm and to do the proper and follow the proper procedures and to protect their patients. The focus is not on intentions or outcomes, but whether the correct actions were taken according to the professional duty. Ethical failure and accountability. From a deontological perspective, the duty to do no harm was violated in this case. The hospital failed its duty of transparency after initially concealing the nature of the death. Even if the mistake was unintentional, the ethical breach still exists because professional rules were broken. And as a result, the nurse lost her license, faced legal consequences, and public trust in healthcare was from then on. So in conclusion, this case shows clear ethical failure when viewed through the lens of deontological framework. Rules and safety procedures exist in the medical industry to protect human life. And when those rules are ignored, even unintentionally, people can die. And in the healthcare industry, there is no room for careless mistakes. You are responsible for the life and well-being of others. And healthcare demands complete attention, responsibility, and professional duty, and those must come first. Thank you for listening. I appreciate your time.